This is Dr. Thomas Burnett, the regenerative medicine specialist here at Regeneration Pittsburgh, and we're talking with Diane today. Diane, thanks for offering to tell us your story about the stem cell procedure that you had. So, I've known Diane now about 3 years, and about 5 months ago, we underwent a bone marrow aspiration and stem cell injection of the left hip because, like I said, you're a lifelong runner and bicyclist, and having a hard time to do that, and actually had to stop that. So we did the injection. That was 5 months ago. Can you give us some updates on how the injection went and how you're feeling now?
Oh, yes. Probably about 5 months ago, my hip hurt so bad, and at one point I just had to stop running. So I came to see Dr. Tom, and I said, what can we do? I said, I love running. I don't want to spend a long time recovering. So he said, well, let's give this stem cell injection a try. So I said, you know what, I'm all game. And so within the first month after I had the shot, I could see that the pain started to slowly, dissipate. And then within about 4 months, all of a sudden I was like, wait, my hip doesn't hurt anymore. So I said, I'm going to start running. And I went for a mile, and I said, oh, it doesn't hurt. And now I'm back to running, and my hip feels great.
That's great. Well, good. So good. So very happy. You had great results too. So the last question: would you recommend this procedure to somebody with similar hip complaints that you had?
Yeah, I would absolutely recommend it. One, because the recovery time is so quick. I waited, about at least, a month, or just slowly went back into exercising. You can still, do light exercise, but highly recommend it. It's quick recovery, and you go into the office, you get your shot, and you leave, and within, the same night you're feeling fine. So definitely, yes.
Thanks again, Diane, for sharing the story.